So one more note on the metabolic dysfunction and how it ties into potentially worse outcomes with SARS-CoV-2 and the virus of the day. We talked about diabetes, we talked about insulin dysregulation, we talked about glucose and how those play a role as well. Jump back. I mean, learning this stuff is so empowering and hopefully fuels the fire to make changes. And then you feel more confidence because you know, hey, people aren't just saying like, look, that's unhealthy. It's, no, there's a reason for it, and here's the mechanism behind it. Okay, let's change that. Let's hedge our bet. Cool, I learned something and I'm more healthy. Let's talk about obesity. Usually a lot of the times it goes hand in hand with diabetes, pre-diabetes, but not always. This has nothing to do with aesthetics. This has nothing to do about being comfortable in your own skin. It's just recognizing and acknowledging what adipose tissue, body fat does, and what it can perpetuate, and if you have an excess of it, other than some of the other issues that we could talk about, why it is particularly relevant to something like SARS-CoV-2. Let's talk about it. Adipose tissue in the body, body fat, it's not just some static tissue making your pant size get larger, making that thing not fit, moving the dial on the scale. It's a metabolically active tissue. We've spoken about this before. It's not just sitting there static. It's playing a role in your body. It's almost like its own organ. It becomes its own organ. It can perpetuate the release of certain hormones in the body and disrupt that, and certain enzymes involved in the signaling of certain hormones in the body. So it's active on that level. And it is an inflammatory tissue. It actually secretes inflammatory compounds in the body, certain things called cytokines in the body, so it's not just sitting there. So if everything else is fine in your body, if you go to your doc and he's like, hey, everything looked good, no diabetes, no pre-diabetes, you're good. But you clearly have more excess adipose tissue. You clearly have more body fat on your body. Again, that is releasing actually inflammation in your body. Inflammation is one of the cornerstones. I mean, the strength of the word loses its power to a certain extent because it's used so much, but it is one of the most, it's an underlying mechanism behind almost every pathology we see, every chronic pathology and the suffering that we see behind it. Inflammation, controlling inflammation, keeping it at a healthy level, that is one of the cornerstones of everything we do. And there are various ways, a plethora of ways that you can alter lifestyle, that you can support it through different ways, that you can keep it under control. Maintaining a healthy body weight is one of them. Again, nothing to do with aesthetics. Just talking about what happens metabolically within. This phenomenon is seen so much that when certain infections, maybe something like Lyme's disease and something like that, when there's certain infections and certain conditions where they're measuring, they're actually not just looking at one of the generic markers for inflammation, high-sensitive C-reactive protein, something that's ordered often to just get a general look at the inflammatory state of the body, but certain infections where they're actually going in and looking at certain inflammatory markers, including cytokines, when they're looking at certain cytokines, trying to determine, are we controlling this infection? Is this infection active? Is it in a state of a flare? Certain ones of those markers, certain cytokines can become falsely elevated in the presence of excess adipose tissue, excess body fat. So therefore getting a false reading, or really making the test somewhat worthless because it's being clouded by the inflammatory molecules, the cytokines being released by the adipose tissue in the body. It's alive. It's secreting things. It's altering your hormones. It's storing more toxins. It's a ground to store more toxins in your body. When you start to lose weight, you start to detox more. Some people start to feel almost bad when they're going through that sometimes because all of a sudden you're mobilizing toxins into the body, so you want to make sure you're prepared for that as well. All a good thing, but you got to do it intelligently and be aware of what can be taking place in the body. But I digress. With the elevated inflammatory markers, elevated cytokines, why might this be a problem? Again, let's just say that your markers were good, and they are actually good, and the insulin's okay, and the glucose is okay, and everything like that. Let's just say you're on the side of obesity, but you have this tissue in the body that is secreting these cytokines and making your baseline inflammatory state higher. Let's just say that that's it, in isolation, by itself. Why would this be a problem with COVID-19? Well, one of the ways this virus seems to be manifesting its worst effects is through that inflammatory storm, that cytokine storm that we talked about in the past. Inflammation, overreactivity of the body, fighting off this thing, that it's being bombarded by this powerful virus, and the immune system, such a robust, overwhelming response that actually causes damage and disruption in the body that can lead to serious issues in the body. We want to make sure your immune system's able to handle that. We want to make sure we have further room from the threshold of going into that cytokine storm, that overwhelming cytokine storm, that my immune system, if this is cytokine storm, my immune system can respond and hit it and get rid of it. If all of a sudden, if I'm starting right here because my cytokines are already elevated due to increased adipose tissue, obesity in the body, I got less wiggle room right there. And if my body needs to mount an inflammatory response, guess what? Doing the right thing, and I'm already over. I'm already over, and I'm into that cytokine storm. I'm already over into an overreactive, overinflamed, overoxidative state, and I'm already closer to succumbing. I'm already closer to sustaining more damage and having to deal with that. So just another thing to think about as far as the metabolic dysfunction and dysregulation. Insulin, glucose, body weight sometimes goes hand in hand with that, sometimes it don't, but it's something that you want to look at. It's something that you want to take seriously and get moving on. Again, these are things that you could start to move the needle on. These are things that you could start to move the scale on. There's always a variety of reasons why they are present, but there's always a variety of ways to attack this. So lower your cytokine, your baseline inflammatory level. Lower that. Get away from that threshold of the cytokine storm and the death and destruction. It makes sense. I know it's not easy, but it's doable.